Thank you very much. Okay, good afternoon, everyone. It's really great to see you all today, and looks like the sun is shining where everyone is, which always helps. My name's Amanda Bates. I'm the Senior Advisor in PPI for the Research Design Service South East, and I'm just going to talk you through a bit of a whistle-stop tour, but a bit of a talk through about service user, carer and practitioner involvement.
Do you want to put it on presenter view, Amanda?
I'm just trying to do that. I'm having so many technical glitches today, so please bear with me. Let's see if this will do it.
I mean, no problem if you can't manage it. We can. That's brilliant. Yeah, that's great. Thank you.
Okay, that's fine. That's fine. Okay, so as I say, a bit of a whistle-stop tour, but certainly what I've learned during my various roles in PPI is that one size certainly does not fit all. There is no formula here, but I think these are some of the key things. Before I talk more about the kind of practicalities, these are some of the key things that I've really thought about. So, nothing about me without me. Some of you may well know this slogan. So, you know, we should not be doing research, making decisions without those who it's going to really affect. We all have a right to be included in research that affects us. Being flexible, being authentic, you know, building those real relationships. That's what I've really learned. The key to having honest conversations. So being authentic, being yourself, and encouraging people to be a critical friend, because obviously what we don't want is for service users, carers say, yep, everything's brilliant, I agree with absolutely everything you've said and everything you're going to do. We really want people to engage with us and be honest about our research. Never underestimate the time it takes to build those relationships. It takes time to build rapport, to build understanding. Please make sure you build that in, and absolutely manage expectations. So for people who perhaps haven't been involved in research before, they may not realise that, you know, not every piece of research gets funded, as we well know, and it can be a very slow process. So just being really clear and honest with people about the realities of research as well. Always taking the time to discuss and reflect together about what's working and what might not be working as well, but I'll talk a little bit more about that later in terms of evaluation. So why do you want involvement? As we know, it is typically a prerequisite, but of course we should not just be ticking that box. We want to think about it in terms of improving the quality and relevance of research, as well as being accountable and transparent. And it's really important, I think, that research teams are clear as to why they are involving people. I think, as I said earlier, this is a rights-based perspective as well. I'm thinking about inviting people with different perspectives, so lived experience. Are you working with communities or groups? And as we know, good quality PPI can really increase the quality of research, and certainly feeding to improving things like recruitment and retention, focusing on people's priorities, and of course clarifying the research as well. And throughout my talk, I've put quite a lot of embedded links in there as well. There's so much brilliant information out there, so please do make use of it. So who might you want to involve? So again, having this really clear purpose for involvement and thinking about who are you actually looking for? What kind of experiences and knowledge are you seeking to bring? Phoebe, of course, spoke earlier about equality, EDI, and really think about having a diversity of perspectives within your research. And again, I've put a link there. So thinking about people's demographics, health status, social and economic factors, but also how are you going to find these people? You know, is it going to be pre-existing groups such as self-advocacy and carers, voluntary organisations, AIDS UK, MenCat, Mind, Rethink. There are so many charities and organisations out there, and many of them now are actually really well set up to work with researchers as partners, but also think about who else you might include. So people who perhaps haven't had their voice heard very much in research before. And again, NIHR has got some really useful frameworks and information on that. There are so many things that people can be involved in when thinking about service user, carer and practitioner involvement. And I could probably spend a good hour and a half just talking through those aspects, but just as just a few examples really. Obviously, everything from coming up with research priorities together, focusing on those research questions, making sure that study remains focused on the issues that really matter to people. Of course, we are keen for people to help us develop and comment on applications. People, of course, can be a co-applicant to a research project. They might join an advisory or steering group. They might deliver training, and also designing and reviewing ethics materials and web pages. I always think as well, present people with kind of menu of opportunities, if you like. So just saying that, there are all these different ways that you can be involved. We're not being prescriptive. We really want to kind of play to people's strengths and their passions, their motivations, and their skills. And obviously, people may well need support and training to undertake these tasks. So thinking about how you can best support people as well. And of course, invite suggestions too about what people might wish to be involved in. So here are some other examples of what people might be able to be involved in. And definitely, I think it's often helping us keep on track and not kind of veering off the path too much, helping us make sense of research findings, helping us find that meaning. Some people I've worked with really enjoy doing blogs and podcasts. So, it shouldn't all be about the written word. So thinking about those other ways. And I know Jennifer talked about or presented that really nice artwork as well, which is great. So just thinking about different ways of communicating our research by using non-traditional methods. Coming up with key recommendations. Some people do really enjoy co-writing reports and articles. And again, it's presenting these as potential opportunities and not being prescriptive. And very importantly, who needs to know about the research? How do we best get our messages out there? So I think people can really help us with that, kind of going through their own, perhaps formal and informal networks, so feeding back to communities, and people know what would work best within their communities as well. Do start PPI before writing the application. I think sometimes it can be really tempting just to kind of race ahead, get all your ideas down on paper, but it's so important that the public voice is represented at the outset. Because for many reasons, really, it really helps with rapport and relationship building, which, as I said earlier, definitely takes time. But really, it's about making the best of the potential, the meaningful involvement of future planning. Because if the only PPI that you do is inviting someone to look at your application the week before submission, that's not going to be meaningful, that's not going to be helpful, and you're not going to have time to really change anything. So please, as early as possible, do start talking to people. Having a whole team commitment to PPI, I think is really important, because I think sometimes what can happen is that one person who rightly might be the PPI lead, name contact, but they are then seen to be the only person doing PPI, and it does need to be the whole research team that is committed to it. Again, I've put some really helpful resources there. So there's really good guidance for working with public co-applicants, also thinking about the role of the designated PPI lead in a research team. There's also a very good interactive course, which although it's aimed at new and experienced PPI reviewers for health and social care research, it can be really helpful for researchers to look at it as well, just to kind of think about the kind of things that might be useful around PPI. The plain English summary, and often I think researchers can find this the hardest thing to write, because you've kind of got to get rid of all that academic jargon and everything else that we can often be so used to writing. So really thinking about how we can best put our research across, and service users, carers, practitioners are really well placed to help us do that and help us do that well. UK standards for public involvement. So these are designed to improve the quality and consistency of PPI, and it's a description of what good PPI looks like. And they provide kind of guidance and reassurance, and they support us all really in working towards what best practice looks like. Again, because of time limitations today, I'm not going to take you through all of them, but they are really helpful. Just again, I think to help us kind of keep on track when we're thinking about PPI in our research. So training and support, of course, is best practice, but you always want to be planning that with your public contributors. You don't have to reinvent the wheel. There are so many resources out there for service users, carers and practitioners. And again, thinking about offering a menu of opportunities, building it into the project plan, thinking about inductions, who the named contact will be for PPI. Clear communication is key. Often though, people don't know what they don't know. So you might have to think about how you might tease some of that out in terms of what people might need, and also always keeping that under review. Payments and involvement. So really, really important topic, and can feel certainly quite tricky, but obviously we want to be able to pay people for their time and expertise, but I'm sure, as many of you know, that for some people accepting payment can impact upon people's benefits. So there are different ways around that. You could offer less, explain people don't have to accept. You might be able to offer a fee or a donation to a group. Again, there is a lot of really useful information out there. Now, at pre-award PPI funding, that can be quite challenging, but do contact your regional research design service, as they may have a PPI fund to help you at the design stage. Do not under budget your PPI in your research. Just again, look at all this really helpful information. Think about all the different things that you might need PPI budget for. Become a really good friend of your finance office at your institution, because these things can be very tricky, and I've certainly come up various hurdles, and I think we've pretty much got there now, but it can be very tricky, especially if you're working with institutions that aren't used to setting up payments for public partners. If your project is funded and people are concerned about how their benefits might be affected by accepting payment, there is the benefits advice service for NIHR projects. And again, that's at the bottom of the page there. Okay, so last but certainly not least, obviously it is best practice to evaluate what we're doing around service user involvement. And it's essential that people receive feedback on their contributions. People want to know, rightly, that they have made a difference to the research and to what's happening. And we want to know if people are okay, are they doing all right? Do they feel that they're valued? Do they feel that they're being listened to? And that's why it's so important to evaluate as we go along, thinking about impact of PPI in research, how we might report it, and again, how we're going to get it out there in terms of blogs, like summaries and co-writing. And again, there's so much information out there, so please do take a look. And again, Thank you. I know that was a real whistle stop tour, but I hope I've put enough information in there for people to revisit when they have the opportunity. So thank you very much for your time and attention today.